Welcome, everyone. We're excited to have you joining us for this conversation. Good seeing some faces I haven't seen in a while. Hey, Khalil, good seeing you.
Good afternoon. How you doing?
Afternoon. Welcome, everyone. Your cameras are allowed in this space, so you can put your cameras on. I know some of you might be eating, doing other things, but if you can, this is going to be a really powerful and intimate conversation. So let us see your faces. Let's engage. Welcome, welcome. Hey, Joe, I saw you earlier. Good seeing you. Welcome. Katie, thank you for joining. Excited to have you. We will get started in a minute. If you can, please introduce yourself in the chat. You can share your organization, your affiliation, and where you are joining us from. I know we got Denver in the building, Delaware. Please do that in the chat as we'll get started in about a minute. And if you can, feel free to turn your cameras on so our panelists, our awesome panelists can see who they're speaking with. It doesn't feel like a webinar where they don't know who's in the room. Hey, Megan. Kelly, thank you for joining us. We got Virginia, Delaware, Philadelphia. If you just joined, please introduce yourself in the chat. We will start our panel momentarily. Your organization, where you're joining us from. We are going to get started right now. Orlando, Florida, welcome, Tyler. Welcome, Gemma. Welcome, Gemma.
Hey there, happy to be here. Looking forward to it, but I will be driving, so I will be listening in this time.
Thank you for joining. Thank you. All right. Well, welcome everyone. I'm excited to kick off our conversation today. If you did not introduce yourself in the chat, please continue to do that. We want to jump right into our conversation. But first, I want to go over a few, what are our norms as well. It's that if you can put your camera on, put your camera on. We want to see you. It's much more interesting than looking at black squares as we have this very, very important conversation. Feel free to use the chat. We say use the chat pretty abundantly. So we will have the conversation. Our panelists will be talking, but I'm certain there's a lot of expertise in this Zoom room here. There are a lot of questions, just a lot of things, right, that we're thinking about, that we're dealing with, that we may be wrestling with on this topic. Type it in the chat. At various points, I will bring other voices into the conversation, either as people asking questions, who are making statements. So use the chat. Do not hold back. Emojis all good. Do that as well in the chat. So cameras on. Thank you. Great seeing wonderful faces here. As well, I wanted to encourage you to use the chat. You can also, as we go through later, I will kick off with some questions, and then you can use the chat. And you also can use the raise hand function in Zoom to ask any questions that you have. And we told our panelists this, and this is how we orient at the Proximity Project. We're going to try to have a real candid conversation about this topic that there's a lot of interest in, and there's a lot of importance in this topic. But for anyone who has not met me, I'm Atinre Aline. I'm the founder of the Proximity Project. The Proximity Project has been going on since 2020. I founded the organization. And it's a very different time, right? As we're going to talk about, right? How the pendulum, right, is swinging. But so many people, I went back and found an email from that time as I was looking for something else, and someone was reaching out to me who typically wasn't having these types of conversations and was like, "What do I do? I didn't know how serious this was." You know, they were in a place of vulnerability and asking questions. And at that moment, I wanted to make sure that we weren't it wasn't just traditional going in, talking, DEI as we always talk about it, but how do we really think about our proximity? So so it's not fleeting, that we're actually in community with the most marginalized voices, most marginalized communities, that we're building that deeper connection. And so we've been doing that for the last 5 years with the Proximity Project cohorts, running our 8-week cohort program. If you're an alum of the Proximity Project, can you shout yourself out in the chat or raise your hand or whatever you want to do? We have had over 300 people complete the program since 2020. And I'm just so honored to have worked with so many people, and to see how they're leading, how they've been leading, and how they're leading in this moment. And I wanted to make sure we have this conversation. So Morgan probably can drop in the chat if he hasn't done it already. Our alumni list, you want to check out some people that have been in the program, but some of them are here. Julie, shout out to Julie, others, Dale, I think you're in the first cohort. But it's also, we love this session. There's some people who are new to our community, and this is also a family union of sorts as we bring people back together for this. We do these sessions every few months to deal with pressing questions, topics, to do the continuous learning, but also to build community. And particularly in moments like right now, a lot of people can feel isolated in your organizations and feel, if how do I navigate? But this is why we're having this conversation today, to learn from some people who are leading the work, doing the work, also asking their own questions, right? Not having it all figured out. So let's engage in the chat. Let's ask our questions, and let's keep pushing forward for more equitable, more justice-oriented organizations as well. So I'm excited to jump right into our conversation, and we have some amazing panelists. I'm going to ask them to introduce yourselves. I mean, I don't need to say much about what we're going through right now, this time, right? What's going on right now with this time, as I mentioned, the juxtaposition with 2020. But it's really critical that we continue to believe that there's power in community, that there's power in activism, there's power in our courage in this work, and that we need to lean into that. So we want to jump into that conversation today. So Robert, you were the first one to be here in the Zoom, so I'm going to ask you to kick off and introduce yourself, the work that you lead. We'll do the quick round of introductions, and I'll jump into our questions.
Thanks, Andre. Pleasure to be here. Grand rising to everyone. My name is Robert Franklin. I use the he, him, his pronouns. I work in the Department of Diversity, Health, Equity, Inclusion at Children's Hospital, Colorado. For now, you'll hear a little bit about that as in the conversation that we're going to have today. It is a pleasure to be a part of any work that Andre and Morgan and the Proximity Project are doing. I have been a long fan of the work and really appreciate your alums being here and being in this conversation. I've been in what we call DEI for much of my professional life, and just happened to get the title right around 2016 in building my own consulting firm. And so the conversation that we're going to have today is both about a lengthy career of transition, but also I think we're going to be talking about, I think you said, Andre, the pendulum. And so what it means to understand the pendulum swinging. And maybe we'll talk a little bit about our history too. So it's a pleasure to be here. Thank you all for taking the time out.
Oh, I love that you talked about history, right? Because I think that I definitely want to get into that at some point, because a lot of people are thinking, right, there's a longer history that I keep pointing back to that gives strength, that gives guidance. But let me not jump there yet. Chris, and then Katie.
Good afternoon, everyone. My name is Chris Otto. I'm a registered nurse coming to you from Delaware, where I serve as the executive director for the Delaware Nurses Association. We are the oldest, largest, and most inclusive professional association for Delaware's 25,000 plus nurses. So we work to strengthen and advance the profession of nursing as the largest sector of the healthcare workforce. We are a proud state affiliate of the American Nurses Association. I know my colleagues up next. But very excited to be here and talk about some of the work we're doing.
Thank you so much. And Katie?
Yes, hi. So honored to be here. And hello, Chris. We work very well together, and I'm really excited about all the work of the Proximity Project. I'm Katie Boston-Leary. I'm the Senior VP of Equity and Engagement at the American Nurses Association, which is also broadly an enterprise. I'm a nurse. I've been a nurse for about 30 years. My pronouns are she, her, hers, and I'm a cisgender Black female. My positionality is generally to learn more about all that makes us us, and that's pretty much my work. My work entails I'm in an inaugural role at our association, and which is trying to turn the page on its past transgressions as it relates to participating and also being complicit in upholding structural racism and interpersonal racism. And that has come with a number of things, right? I'm sorry about my alerts. I'll turn those off. We're funding an apology statement that we did. I'm so sorry. This is like going out of control now that I'm talking. We have an apology statement that we have put out, which is our racial reckoning statement. I'll put those in the chat. We have a commission to address racism in nursing as well that we've also put out there that was approved in 2022. We just had an equity summit in DC a few weeks after the executive orders came out to show that this is where we are. We're not moving from it. Even if we change our language, the work is still the work. We also fund a number of organizations like Chris's to help them further the work as well. And not just associations, but also institutions like one example is the Children's Hospital of DC, and they are working on hair care for children and making sure that the typical shampoos and conditioners that are usually in these welcome baskets that are not necessarily helpful to kids of minority ethnic backgrounds to make sure that they have proper hair care for their body image. Sustainability as well. So doing a lot. I know we're going to get into that, but I'm just excited to be here and to be with you all.
Thank you so much for sharing that. I can maybe start with you. Let me see who we'll start with. Let me go back around to the beginning and go to Robert. And Robert, maybe if you can just share, because the question I ask all of you is, so we talk about shifting, right? 2020 into now, how has that looked like in your region? How has that looked like in your work? Maybe just start with what is the changes, the federal things going on? What does that look like for your work at this point? And then, for a lot of us want to know how you're navigating it, but maybe just paint the picture of how your work has been impacted so far. And others, who are here, drop in the chat as well if there are other things that are going on and what you're experiencing on that front as well. But we'll start Robert and then Chris and come back to Katie.
Yeah, if I may, before answering the full question, I just I was typing it and then you called my name, and so I figured I'd just say it out loud. Katie just reminded me that even at Children's Colorado, we have learned, we already knew, but we have made moves on how not every kid's hair is the same. And when you stay at a hospital for a night, for 3 nights, for 3 months, and sometimes because of pediatric healthcare needs, it's even longer than that, your hair needs to be taken care of. And especially if you are a patient or from a community where your hair is a part of self-image, hair is a part of your emotional health, not having it taken care of properly is a problem, is a big problem. And it just exacerbates what you're doing. And so the work that probably the hospital in DC is working on is we're working on too. Spoiler alert though, there is no one ethnic hair care product that works across all ethnic hair. And so while our leaders that got the we used Cantu, and this is not a commercial for Cantu, but we got Cantu into our spaces. And it was an easy way for us to do that from a supplier perspective. We now have other patients who have other hair care needs, and so we're trying to figure that out. How do you customize and do that much needed equity work, that customization of care work, and that was before 2025. We know that we have more work to do, and that's a lead into your question, answering your question, Andre, that before, well, you went back to 2020. So if you think about 2020, and health equity wasn't even a conversation really across healthcare spaces. There were a lot of public health folks that were talking about health equity, but it wasn't a healthcare conversation. It was pretty easily understood that in a hospital, you go there for your medicine, you go there for your care, you go there for the science, and everything else was up to you. So your social drivers and social determinants were supposed to be decided by you. And the pandemic across the world showed us that's not the case, that the science is what, 18, maybe 20% of what it is that really comes down to care and our ability to get healthy. And so health equity is everyone's responsibility. And that was it wasn't an easy shift of mindset, but we got into it, and everybody across the world, it made sense. Now, there are folks that don't agree about all the science, and there are folks that don't agree about all the reasons why health equity is even a need for us to define and to challenge. And at least at Children's Hospital of Colorado, and actually I would argue the Children's Hospital Association across the United States understood the work that needed to be done to close health gaps. Now in 2025, those health gaps still exist, and we still have a responsibility to close them, because again, the science, the medicine is only going to be 18-20% of the work. And indeed, for some folks who are afraid of raids by ICE, or afraid of losing their jobs, or afraid of whatever might happen, there's actually, I think, less impact that the medicine and the science will have. And so we still have a job to do the closing of the gap for so many families, patients and their families. And it's gotten harder. It's gotten so much harder. But I think, and I could take up the whole hour just talking about how hard it has gotten. But Andre, what I'll say in terms of the impact of the work, I actually go back to COVID time, that moment in our collective history where I remember grieving going to work virtually. Like today in April of 2025, I'm on Zoom talking to you all, and it won't be my last Zoom or Teams meeting, Microsoft Teams meeting. I know how to do that. I know how to deliver this way. I can remember March of 2020 in tears, not knowing how I was going to build relationships, educate folks, talk to the people. I didn't know how I was going to do that from my home. It just didn't make sense. And I went through the grief process. And so I do believe this is where we are now, in having to go from being angry and sad to bargaining and acceptance. I'm not there yet, but I think we're headed in that direction. And that includes a number of shifts that we never thought might even happen. And so the words themselves are becoming fodder for a war against health. And it's an amazing thing to say out loud, but it's not dissimilar to the pandemic and where we were politically or socially. And again, Ottenray, if you want to get into a history lesson, there's a playbook at play that we could talk about that's even deeper than 2020. I'll pause on that.
Thank you so much. Thanks. Chris, you have big sets of work that you're doing on the front of equity, inclusion, justice, and you also have these forces that are attacking all those things, right? So how has that impacted you? What does that look like in your work?
Yeah, it was an initial shock, for sure, when the first executive order came out targeting DEI, and we had to undertake an immediate and thorough evaluation of not just that EO, but the downstream impacts to our work. We receive pass-through federal funding to support nurse mental health. We also received funding from the American Nurses Enterprise to advance DEI efforts through our association. So we had to undertake that evaluation to ensure where our risk, to understand where our risks were and identify what the path forward was. Fortunately for us, between legal challenges, clarifications, and subsequent communications, we reaffirmed our work. We affirmed our commitment to our members, to our community, to nurses. It certainly was not intentional that the Code of Ethics for Nurses is updated every 10 years, and the revised version came out this year, but that has continued to be a North Star that we point to and point nurses to as far as the work of equity, inclusion, respect, for the inherent dignity and worth of every individual, global nursing, looking at immigration and other aspects. So we are still in it, and we just had to reaffirm that. We've always been committed to it since 2020 when we in the wake of George Floyd, Breonna Taylor, Ahmaud Arbery, and others, we completed webinar, put statements out, began really ramping up efforts around that work. So when I think about your juxtaposition as well as ours, so in some ways it feels like we're starting over again, but in other ways we're still in it. We're committed. We're engaging with nurses. We're building an anti-racist nursing workforce at the state and national level with the support of ANA and the National Commission. So yeah, I'll leave it there. I can certainly go on as well, but want to let my colleague get her thoughts in.
Thank you, Katie.
Yeah, I think anything I say from what Robert said and Chris is additive. And particularly what Robert said about, a lot of what we're seeing, even though it feels like a sledgehammer, it's actually surgical. The attack on foundational structures that helps us evolve as a society, like the education system, like where science is called and where these policies are made around health and all that. I think the less secure and safe and informed people are, the more misinformation will work. And that is the way dominant cultures stay in power. And there's so many examples around the globe in terms of how this works. If you look at what happens in Russia, where people they set up systems where people are so reliant on the government, and even institutions where people are supposed to be informed, like educational institutions, universities, where people are supposed to be more aware and be able to be free thinkers and be able to challenge systems and structures. That's under attack too, right? There's an effort for a collective bending of the knee. And there's this effort to have legal systems and legal practices also sign on. So these are all strongholds that are being set up around us. And I'm not saying this to scare anyone. It's really for us to be awake and aware of what's going on. But where none of this is happening by accident. The system is being designed for us to get tired and be reliant and less informed and to be sick. So when you have all this happening, you think about, what role do we have? And I know I'm aware of the work that we're doing at ANA and how we are, and ANA is not perfect. We've had even with this reconciliation statement, all this work, we've had our issues too. I would actually be working on stuff about racism and having racist acts committed towards me while I'm doing the work. So and this is kind of the thing about how, people play in your face all day as long as you let them. So we have to get into this place of awareness, and really taking the time to understanding where our evidence is coming from. That's an evidential maturity that we have to have. I just saw, but right before this call, Elizabeth Holmes, who was convicted for, and I hope everyone here knows her story. She was convicted and she's in jail for lab testing that were inaccurate that harmed so many people. And there is a lab tech that had a conference with a number of folks to say that her testing was correct. Almost like there wasn't even a trial that proved that this was, and they're leveraging pop culture rappers to profess their innocence. So this is where we are. This is where we're at. And yes, we are in a place now where we have the long arm of the government that's overreaching and saying that you can't do this. And is it impacting us as an association? Absolutely. We were just having discussions around, the banned list of words and how we manage that and navigate that. But my position on that, and we just had a discussion yesterday, and I say this till the cows come home, even though the EOs say something different. The EOs tell you that DEI is illegal. It's not. There are a number of crazy EOs that went out there that didn't enact law, but for some reason, this is the one that people go, oh my gosh, it's illegal. We can't do it. So I will continue to say until I see some form of policy around people getting arrested for this work, that I'll stop doing it. But I wouldn't even stop. I'll just call it something different. And the good thing about the English language is that it's very deep. And the more you ban words, the more can come up more to continue the work. So the key messaging here is that let them lose sleep trying to keep up with us. I'm not going to get hung up on words, acronyms or whatever. You can take DEI, but what you're not going to take is my spirit and my actions and my ability to advocate for what's right for all people. So that's where we are.
Oh wow, I love that. Any a response there, Robert? Because I think you started something, right? You talking about there's just this persistence and resilience there, right? I think for people who already were in a place of being fired up about this work, right? Being committed to this work deeply, they're not as moved, right? What I'm hearing from you, not as moved with how things might need to adapt, right? The work still goes on in certain ways, and other people who were kind of unclear, unsure about it, right? They're kind of retreating, and then there's other people who might be scared, right? But I really appreciate hearing that. Robert, any response to that, and start there, and then Chris.
Yeah, well, first of all, Katie's on fire, and I appreciate that on a Wednesday for sure. And so we'll certainly echo so much of what has been said. The surgical part, I noted that in the chat. That phrase, that concept, that's so well said, because the sowing in of fear isn't just at the level of, oh, I have a DEI in my title. So my title is Diversity, Health, Equity, Inclusion Director. Certainly we can change that, but the fear, Katie, that you mentioned is everywhere. And so no one has to necessarily be arrested for us all to fear what might happen if. And the most recent policy, the attestation policy from HHS, the Health and Human Services, that says if you attest that you don't do DEI or DEIA or quote discriminatory equity ideology, then we will take away your Medicaid, Medicare, TRICARE, and all those grants that you were doing good research on. And so just the fear of that can cancel programs, departments, the work. I think someone was asking a question about archiving of information. So because of the fears that we might lose money, opportunity, or have to fight the Department of Justice or the federal government and possibly lose that battle, a lot of organizations are making changes to stay out of the spotlight. And the more fear that is sown in, the less the federal government, the president, the Department of Justice have to really do. It's just out there now. Those executive orders are just out there now. And the media, all of our conversations are just flowing through it. So I love the resilience that Katie has shown. And I hope that those of you who are on this call have some of that as well, because we're going to need you to do the actual work. It might be Kamala. I hope I pronounced that correct. Someone said to me that this is Reconstruction revisited. And so if we remember that public health and access to medicine didn't come from the established spaces of healthcare at the time in the late 1800s, the early 1900s, and really not until very recently was equitable healthcare, even accessible to many of us, it has always been underground. The Black Panther Party made sure that people had food, housing, and water, and then they were assassinated for doing that work. How many labor unions and labor movements had to come up and be then quashed to get us to where we are now. So the Underground Railroad of 2025, you're not that far off from what it is. Carla said, none of this is new. And Ottenray, that's what I'll end with, is that there's a group of us in our populace who do think this is new, who don't understand the surgicalness that Katie was naming, that here in our country and in the world, the propaganda around who is and who isn't worthy, who should and who shouldn't be isn't disadvantaged, the policing of words, we've seen that. And we used to be, as a United States of America, on one side of that freedom spectrum. Now we find ourselves on the other side. And what I am most concerned about, the thing that I'm most worried about, is who is going to save us when it comes time. And I'm not really sure about that.
Thank you so much, Chris. I'm going to get you. One thing I wanted to say, connected to what Katie said and what Robert said, is making my plug in for proximity. That if in moments like this, the conversations that we're having are just in our boardrooms, right? It just kind of institutionalized. And unlike what Robert said, where there always have been groups, and there currently are groups like the Black Panthers, that are people that are delivering healthcare, right? Grassroots groups that are delivering healthcare, that are their resolve is not waning, right? They're doing the work with minimal resources. When you connect to them, for any of y'all on here, because I think we lean mostly in this group, people who are working within organizations, some larger organizations, if you're not connecting to them, you are going, and you don't have that proximity, it is going to impact also how you view these things, right? It's just going to be kind of a corporate protection, right? All those other things, right? When you connect to people who are really vulnerable in so many ways, but yet they're still pushing. As someone who's a nonprofit founder, or founded a nonprofit organization, just this week, right, we lost the AmeriCorps staff, right? Like people who do have much less resources, much less staff than a lot of organizations that might be represented here, but are still pushing the work. It will give you more courage, right? More commitment, because that's okay to say that. It's not something that everyone has an endless supply of, right? But I find that connecting to those who are really pushing, doing the work on the grassroots level in the communities, the people that we're serving, is going to kind of give you help with that in this moment where a lot of people are retreating. Chris, you want to react to that, and then Carla, I'll have you ask your question.
Yeah, I'll be quick. But before I start, I have to say and give flowers to Katie. That's Katie 24/7. She's always on when I need to jumpstart my battery. I call Katie up and get a good talking to. So I'm glad she's here with us. But the part I want to comment on, and my reaction to words that both Katie and Robert shared, is around the fear and the community and the intentionality that we as nonprofits have to continue to build to create the spaces where folks can come together, have these conversations. Carla, one of her questions was, about, where do we go? What becomes the next spot that we collaborate and communicate with this on? It's looking for the non-traditional, where it may not say, to, Katie's point, they can take DEI away from us, they can take those words, but we're still going to do the work. And a group like the Delaware Nurses Association may not come to mind per se, a top of mind as the place to go to collaborate and have those communications, but we are committed to the work. You have nonprofits, we're connected to Proximity Project, other organizations, Black Nurses Rock Delaware Collaborative, to continue the work, to continue creating the spaces, because the fear is out there and some folks are latching onto it, taking it as an opportunity to disengage from the work some, but we have to, and we'll continue to communicate, collaborate, create the spaces, elevate the messages, and continue to make an impact for our communities.
Thank you so much, Carla. I want to go to, I know the people here who like have questions that will help you in your work or will help you feel seen in this moment. So please ask them, put them in the chat, raise your Zoom hand. I'm going to go with Carla.
Hi, thank you so much for holding this space. I appreciate it. And to those who are speaking, really appreciate your perspective. I work with Christiana Care Health System and sort of recognizing the footprint in terms of the communities that we serve. I'm mindful of a lot of the documentation that is getting lost or the data that's not really archived in a way that can be meaningful in the ways that it has in the past. Just wondering how we don't lose the momentum that we've gained in terms of like making sure that we're passing along this information to those who could benefit from it, those organizations and systems that do need additional support. Like, how do we keep those channels of communication open, knowing that everything's shifting?
Thanks for the question. And others in the, as our panelists answered, if you have resources or thoughts or ideas, please write them in the chat as well, because I know others might have some suggestions there. All right, whoever wants to jump on that one.
I can speak. I can speak to that a little bit. That is a challenge for us because as a people, we're not that good at documenting our history. But part of the dynamic is that you find because of what it means, you tend to not know you're making history when you're making it. And even for a lot of us on this call, there are a number of things that we're probably doing now, this history making, but we're not even thinking about our ancestorship. Like, how is this going to be captured for the people that are coming after me? How do they know that I was involved in this fight and helping with the resistance? And I think that's why I encourage people to write. I encourage people to develop frameworks. Like, I was at a point a couple of years ago where I got tired of hearing people say, I don't know what all these DI concepts mean. Like, they all seem to be tripping over each other. Like, I don't know what they mean. I was like, oh, well, let me figure out how I can decode that for folks who are probably, honestly don't know what it means, but there are people that are also lazy, that don't want to do the work. So I found, I decided, so let me find a framework that everyone's familiar with. And then I saw, it hit me immediately that Maslow's hierarchy of needs is cross-cuts every industry, is not just in healthcare. And I set up the DI concepts around Maslow's. And people are like, oh my gosh, but there's a reason you do that, is because people tend to say, I don't know, I'm not sure, and everything else, and people don't want to do the work. So I think we need to be better documentarians of what we're doing, where we are, what we're feeling. I do blogs all the time as well to, like when Claudine Gay had her issues when she was let go after she followed her talking points to testify on Capitol Hill and got fired because people reacted. And those points that she made were not her own, but they needed a scapegoat. And there she went. So I did an op-ed on that. So I do think that we need to um, uh, be our own documentarians and historians by putting our work out there, putting our thoughts out there, keeping our own journals, making sure that our families know where they are in case, when we're not here, because we're in this encasement. We don't know when it'll be our time. And that's the way we go about it. But I appreciate the Underground Railroad because that's thinking that's happening right now. And by the way, I sound preachy because I just did a talk, so I was at a podium. So I think that's what I'm carrying over here. So I apologize. I'm usually a lot more subdued and introspective, I think. But this Underground Railroad reference, which is so significant because when I talk about this resistance that we're in, and there was this great op-ed that came out a few weeks ago about how it was in the New York Times about how Black America is not surprised, right? And I'm looking at a comment earlier about how, we've seen this before. There's a reason why most of the Black American community is learning new line dances while things are going on. And it's really because we knew you know, this was coming. We've seen this before. We're not surprised. We're in this I told you so kind of phase. And we're also trying to manage our angst by saying, you know, I'm going to learn boots on the ground for now. I'm not going to get caught up in this right now. And it's okay because by design, the systems is, you know, set up for us to get tired out and for us to walk away. This is preservation of soul and spirit. So that's why we're doing this right now. Doesn't mean that we're not doing any fighting or resistance. No, we're doing it. And if there are folks that are forgetting that we should, reminder, we should. There are a number of ways to set up this Underground Railroad. And using that reference, we're from lineage of folks that got really creative in the struggle. How did all those people gather in Washington for Martin Luther King's speech when there was no internet, no social media? How did that happen? How did people find their way to the Underground Railroad when it was illegal for them to learn to read and write? Right? And they use cornrows as maps. Like that's where I'm from. And using those examples is where I'm saying, I can get creative too. I can get creative too. So yes, you know, we've seen this before. We're not surprised, but make no mistake, we still have work to do. But at the same time, we have to put a community around us and not own it ourselves because this, you know, our body keeps score. This could get soaked in our bones, in our minds, in our hearts and everything. It's hard work. So the community aspect is major here. This is not for a singular person to take on. This is for all of us to take on. And we have to now, for everyone that is impacted by this, and it's not just a Black community, we have to adopt the thinking that if you come for one of us, you come for all of us. Period. So we are each other's keepers.
So there's no need, Katie, to apologize for being preachy. I feel like I'm in the pew myself and appreciating you singing the songs and the hymns that I know the songs to, the words to. I heard Carla's question differently than you did. So I'm really glad that you took that direction, because I was thinking about the actual data that we have been collecting, let's say, for the last 3 or 4 or 5 years when we're thinking about health equity. It's not illegal to track race, ethnicity, and language and disaggregate it in your patient population, in your student population, in your community health organization. That's not illegal. What's interesting is that the executive orders lay out preferential and or discriminatory practices in hiring specifically, according to the Civil Rights legislation of 1964. So collecting that information to improve access to healthcare, or improve health outcomes, or improve educational outcomes, or socioeconomic outcomes hasn't been named. So you can still do that. So if you don't have a space where you're disaggregating outcome data, whatever that is, doesn't have to be health, but since we're talking about health equity, that's disaggregating health outcome data, that's the first place to start. You don't need to have a training on that. You just need to look at your electronic health record or your chart records and be able to do that. And when you notice a pattern, then you have some things that you can respond to. Now, would it be nice that we train our folks who would have to do the responding to understand unconscious and systemic biases? Absolutely. Would it be great to have an anti-racist practice and pedagogy that undergirds any work towards closing health gaps? Absolutely. What you can't guarantee, though, is that someone in your organization, when they're told that they need to be thinking about biases or having an anti-racist equity lens, that they won't send a screenshot of that PowerPoint that you shared with them to the EEOC, saying that they have been harassed with regard to DEI, and then having to go in that whole process. Again, it's not illegal, to Katie's point. It's just that you're going to have all those problems. So when I saw you ask the question about data and the archiving of data, I think we still need to make sure that we're doing that. We still need to be able to point out that Black maternal health is a cancer across the United States, and in some of our states even more so. That prematurity and infant mortality is interestingly not a problem that we can't fix, but our systems are built not to fix them. And that's the history part. I would definitely want to toss to Chris, but because Andre, I said I would. Children's Hospital Colorado was formed in 1908, and we celebrate that idea often. When we think about knowing our history, archiving our history, and talking about it, we don't often talk about in 1908, pediatric healthcare was really new and novel, and so only a few places, especially in metropolitan areas, were taking care of kids in the way that we do now. So we didn't even have this idea. But the women, the nurses who were in charge of building this pediatric health system here in Colorado, one of them, the matriarchs of it, was also involved in the eugenics movement. And she used that as her platform and her political platform as she went on to do other things here in the Denver Metro. And if you are familiar with the eugenics movement, then you know that that actually doesn't get us to health equity for all. For some, but not for all. And so that's deeply embedded into the history of this world-renowned hospital out here in the Midwest, or in the West. And we've got to be able to talk about that. And that is documented. We know that. But who's going to say it out loud? Me. And I hope that you all are able to see that in your organizations as well, that the formation of it feels like that founding fathers piece is so nice and so good and so heartwarming. And what we all know about 1908 is that many of us on this call would not have gotten great care, certainly not health equity access to us. And so that reality is repeatable if we're not careful.
Thank you so much. I'm going to open up for more questions, and maybe someone we can have you start with that question, Chris. Other questions? I want to make sure before we wrap up, everyone gets to ask what's kind of pressing for them. Everyone's contemplating.
Thinking hard. What questions do you have?
I'm gonna while others are doing that, you can type in type it there. You also can write to Morgan anonymously if you want as well. Sometimes people don't want to ask the question as well, but to what we've been talking about, the preservation of soul, because I think some of what people are kind of coming into this conversation is like it's a lot, right? It's a lot going on. Chris, how are you doing that for yourself, right? Around the just like what things are you reading? What have been most helpful for you to keep you kind of focused, to keep you informed, right, with all these changes that are happening in your work, right? And then as you also you support so many others, right? How are you kind of passing that along? Like, what are those resources, the groups that you're going to, the things that you're reading, the people that you're following on social media, whatever it is? What are those things that are really helping you to stay grounded, to stay committed, to stay informed, because there's a lot of misinformation, there's a lot of fear going on right now?
Yeah, it's absolutely the individual conversations that I've been having with nurses, healthcare professionals, with leaders in the space to make the fight personal again, to make it about people, to make it about each other. I do my best. I'm not perfect to stay away from social media. I use it to consume the information and as a guide to where I need to go to get the truth. Social media is very good at sensationalizing the headlines, the EOs, the actions. So I use that as a starting point, get off of it quickly, and investigate through the sources of truth to figure out what's actually going on, to phone a friend, to phone Katie, to phone others, to really decode what we're hearing, connect back to the truth, connect back to the people. Even when I think about the data conversation that we were having, and collecting and storing information, around gender, race, ethnicity, sexual orientation, sexual identity, gender identity, you shift that conversation because it's about the people. It's about who you're caring for, who the person is in front of you, and how you communicate that shift to shift, person to person, provider to provider, that moves it from just, from DEI to the very real implications of caring for someone holistically, seeing who they are, recognizing the hurdles that they've had to overcome. And I say that because I still practice clinically, so I'm blending my worlds of what I do in healthcare and what I do in the nonprofit space. So, and any, and it all comes down to the community that we build, the company that we keep, to maintain that resilience, to stay committed to the work.
Thank you so much. Now the questions are rolling in. It always takes a.
All right, let's see what we got.
Let me go to Chris. Can you ask your question? Introduce yourself.
The question from Rob.
Oh, no, Chris Frazier, if you want to ask.
Oh.
Chris, you ask the question.
Yeah, I was curious. Thank you. I was curious about how you all suggest we continue the conversation with those who are threatened by diversity, equity, inclusion, and what you're doing to actually show the value of health equity to them themselves and the healthcare system overall.
Thanks for the question, Chris. Who wants to start?
I guess I could. So I really do believe that it starts with letting people know that it's not illegal, and also recognize that the EOs that are the drivers of a lot of the fear out here are intentionally unclear. Because when they're unclear, people tend to go above and beyond. That's that anticipatory obedience that they expect. And there are a lot of organizations and leaders that are participating in that because they lean to their legal expertise and departments that say you can't. But in every system, you have your legal advice you're going to get, and their role is to protect the organization. But above that is leadership, true leadership. True leadership right now looks like what's happening at Harvard. True leadership is also what's happening in Loudoun County in Virginia, where the superintendent of schools there was asked to sign a almost like a certification statement that they're not engaging in any DEI work, and the condition of that is for you to continue to get funding for your school. And his response was, until you give me clarity, around here is business as usual. I don't have any clarity about what you're talking about. And they're not going to give you anything clear because they know that they're going to have a hard time throwing a net around this to make it make sense. So I think we should encourage our leaders to be neuro leaders, to see what else is happening out there in this space and use those examples to do the right thing. Because what's being asked of us is for us to hurt and harm people. That's what's being asked for us point blank, right? To turn a blind eye to the evidence is very clear that people are dying, losing life and limb faster than a number of other people, having lack of access, all that. That's what they're asking us to do. So this is, does your role align with your soul time, right? And really make sure that for folks that need help them see what real leadership should look like during this time. And for us to not engage in obedience type efforts, because and focus on the right things. Because again, as I said earlier, I don't care about words. And our equity statement that we created for ANA, we didn't say policies need to be changed. We're saying that we will not rest until equity is embedded in the hearts and hands of every nurse. That's where the work is. Getting the people there, And it's less about, to me, about some of those structural things, even though we work on structures too, but people are within structures. So that's what we need our leaders to do. Let your hands and hearts show where you really are, and show the values that you have touted for years for these organizations that you lead.
I'll capitalize on that last part that you were just talking about there, Katie. Your values at whatever organization you're at most likely connect to what we have been talking about with regard to equity. Most likely. Like some of them are integrity or excellence or communication or respect. And so how are we actually living through our values if we allow folks to be hurt and harmed in this work? If we take away programs or projects or activities that we know has been lifting folks and providing them the excellent care that they're supposed to be getting. I think you can always point to things that you're already doing. Most likely in our organizations, you have curb cuts or ramps or automatic door openers or nursing rooms. You might even have accessibility needs on your website. Like we're already doing that stuff for certain groups of people because it's a part of who we are. It's in our fabric, if you will, of our organization. And so for those folks who need an example of why it helps all of us, there are those that are out there. And so if some of you are hearing me say this and you're wondering like, what are you talking about, Robert? That's a great Google opportunity is to Google what has been done in equity in my community and share that with folks. Have a lunch and learn about how equity is something we have all benefited from. And those of us who are here or a part of the Proximity Project, you probably already have that in your mindset, in your back pocket. No, and the last thing I will say though is that Ott and Ray are always challenging us to get in proximity, and that's so crucial not only for us but for those around us. And so take somebody with you when you're in community, when you are moving in those spaces, and that might lead to, if you're talking to a hiring manager, nursing hiring manager, or something like that. That might lead them to different ways of thinking about their panels and their recruiting. That instead of it being surgically removed, how we think about diversity, equity, inclusion, or whatever it will be called, we are surgically implanting into their ideas and understanding that those people over there are the best qualified because they work in that community, they're from that community, they speak that language, et cetera, and will deliver on the promises of our mission-driven work because you got them to be proximate. Ott and Ray, how'd I do?
You did great. You did great. I know you got to wrap up early. I think thank you so much. I think the other part that I want to add to that is when we designed the Proximity Project, I said this in our recent cohort, we were very adamant that we weren't just designing some like learning objectives, and like the first objective before the content was feeling, right? That when you hear a panelist, right, from the community talking about their experience, giving birth, right, and right, it's versus just using words, right, like social determinants of health, right? So I still think that's a huge gap for people because we get we intellectualize things, but what I think converts people or moves people along is feeling, hearing, seeing real stories of impact, as well as Robert was saying, of like how, because the words DEI, diversity, equity, inclusion, right? People can then put a lot of, as what's happened, put a lot of things into those words, right? Versus actually hearing real stories, bringing people, I keep saying that, like how many people are bringing real people, right, into your organizations to speak at your team meetings, on panels. We're always bringing just people on the speaker circuit, but bringing real people, I think that's something else there. And I know we're getting close to time. I wanted to get to the question from who was Kelly, your question, if you can ask your question.
Thank you. I was just curious, as somebody who works externally with public relations, if you all have examples of organizations, I know you mentioned Harvard, who are getting it right, specifically in terms of that storytelling, because I know there is a pressure to make sure that we are using the quote right words and not using other words. And boy, that hamstrings a lot of storytelling. So if you have organizations who are doing it right, or you've seen examples, please, I'd love to hear them. Thank you.
Kelly, I'll just to answer that, one of the things that we're doing is not only are we working on our own acronym around this work, and we all know that there's a list of banned words, supposedly. We're creating our list of acceptable words, right? And the list is growing. And it's funny how that list dwarfs the banned list. And when you create your list, when you gather folks and you create your list of words to help you not only describe where you're going, but the current state, because you want to be able to describe the current state, you want to make sure that you make sure people, you don't publicize it. It's yours. That's the underground piece. It is yours for you to use for your programming, because the more you publicize it, the more it gets on the ban list per se. So that's what I encourage you to do. Like, get a community around, coalition around building your own lists of how you're going to describe the current state appropriately, and also set up your vision for where you want to go and make it make sense.
I love that. Maybe the question come to you. I want to make sure we get to all the questions. The question from Joe. You want to ask your question, Joe? Joe, and maybe Chris, you want to take that?
Yeah, everybody. Yeah, I was just kind of interested in what conversations are happening at your organizations around like contingency planning, scenario planning, with just so much news, so much legal challenges. There's just so much going on a daily basis. Kind of interested in grounding a little bit in kind of what are the big things that are just kind of keeping folks up at night at this moment? Is what's kind of top of mind for you?
We lost Chris for a second. Katie, you want to try that one first, and then we'll get Chris back on.
Yeah, so we have a process where we are every week we look at what new orders are out there and how it impacts our organization, and we look at financial risk, reputational risk, social risk, ethical risk, so, and we try to put things in buckets, and that determines our response, because we're in this place where there are a number of stakeholders that want to see us respond to every single dumb thing that comes politically, and we're not doing that, because the key thing for us right now what I'll suggest to you is temperance. Temperance is really about how you manage yourself in a disciplined way, and you're not catching every ball that's thrown to you. It's, if you think about your car, it's the water coolant system in your car, and keeps your car cool while you're going through the elements, right? So temperance is the key here for you to understand what the risks are, how you respond to those risks. So have your contingency plans. We're doing that too, because we keep hearing, and I believe it, this is the appetizer. We haven't seen the main course yet. So how do we prepare for the main course? So you do want to have these things in place to prepare you for when things come. But what I continue to tell organizations that are bound out from this work is, when the order does come, and we're seeing it with some of the journals, medical journals and things like that, it's never because you do this, you're going to suffer this penalty. It's always about the moving forward. Like a test that you won't do this moving forward. So that's where the contingency plans come in. Yes, we know that organizations, some learning organizations receive letters because of, like Columbia and all that, like we've seen that you don't necessarily support, so we're going to take your funding away. That is happening too. But we have to make sure that we are recognizing that this is a different fight. This is not what we used to do. We don't agree with every administration, but this one is retaliatory. This one is applying cruelty with a harshness. Right. And they're setting up watchdogs to harm people that are doing the work that they're supposed to. So that's why we have to use a different approach. I have this group that's saying, we're going to do a march. I said, this is not march territory we're in. It's just not. Like, you're going to feel good about it, but really, what is that going to do? It probably actually have them salivating that, oh, that's good. And the key thing also, we need to remember that to a certain degree, some of these things that are happening, they're setting it up to draw us out. And when they draw us out where we're exposed and we're protesting, that's when they come. So I really do believe that we have to stay planted, think about our strategy. Don't react, just act. You can't react to everything, because that's where we'll have our missteps, and that's where we put ourselves at risk.
a key, I mean, that's a key portion of scenario planning. I had to chuckle because I actually just went to some scenario planning strategy sessions recently. And a key concept in scenario planning is the plausibility. We can't react to everything. We have to assess and risk stratify to see what is viable, what is unviable, what is you know, just a show, just a show of power. That's why I go to the source of truth. I have read those EOs over and over again. I follow the court proceedings where these are being challenged because that's where my true scenario planning is going to happen. That's the true contingency plan, is not the headline, is not uh, the show of it all, but the actual words that are being said and how they are going to impact me. That's the decision utility of what do I need to do or plan to do differently in, these exorbitant amount of scenarios that could happen.
Thank you so much. Thank you for posting that. One thing that I would also encourage, and I know we're coming to conclusion. Is I would encourage as well. Kind of going to continue to push that piece is empower. Right. A lot of times we talk about this, Joe and others. Right. We talk about this as like organizations kind of in isolation, doing what you need to do to preserve your organization. Right. Which makes that part. Some part makes sense. The other part is, how are you in community though with a lot of other, the other organizations in your city, in your state, in your right, maybe kind of cross state? How are you kind of where's the collective there? And then how are we also with what we know empowering people, right? That's what I want to push everyone to, because there's a lot of things there's things that you might be able to do from your seat in an organization that individuals can do in the community, right? Who are not don't have the certain things at stake, right? But I believe there's so much information we have when Chris is talking about the EOs and all things like that, the people out there in the community don't know, right? They don't know this information, right? So how do we also share that privilege, share that information, right? And it was brought up by the Black Panthers before, right? This is what they were doing. They were teaching people how to fish, right? Like, you don't need to go this, you can do these tests on your own, you can do these things on your own as well. So I really encourage that as well, of in these moments, connecting to regular folks, regular folks, letting them know what you know. And I'll give you an example from my work more on the education side. I wrote a piece recently. I work with a bunch of students of color, help them get into college. And a lot of them now are like, what's next? They're graduating college, right? And I wrote a piece because a lot of them, I felt like, with what I know, are not reading the tea leaves, and they're kind of making strategic maybe missteps is how they're navigating this environment right now, right? They're like, oh, I'm going to grad school, and maybe that's fine, but I'm like, the things have shifted, right? A lot of them, you might think you're going to grad school and the funding is gone, right? And so with the privilege that I have, the knowledge I have, the connections that I have, I try to write some things of like, here's how I would navigate what's going on. Here's what I know that you might not know because of the conversations that I'm in. So I would encourage you that also in the healthcare space as well, because that cross-pollination between the individuals, the community groups, the grassroots groups, the access they have that you don't, and the access you don't that they do, right? There's a lot of power. There's a lot of power there also, right? And information that you will get as well that can feed, as the question came about storytelling and so forth as well. So I know that we are over time. I wanted to give our panelists, the ones that, to any kind of final words they wanted to share. And for anyone else, we booked time. If anyone else wanted to stay a little longer just to like talk or share anything, I will still be here. But Katie and Chris, I want to give you any final comments to your charge for the people that have joined today.
So there's a leadership model that we are merging with our Maslow's framework for DEI, and it's really human-centered leadership. And this model calls for leaders to be awakeners, for them to be upholders, and for them to be connectors. And that's what we need more of now. Be careful in the times that we're in, because it's very easy to become a useful idiot right now. So let's stay informed, let's stay connected, and let's stay true to what is right in every sense, because that's the way we're coded humanistically. And let's not replicate and parrot a lot of the things that will keep us in this place of harm and fear. Thank you for having me.
Thank you. It was beautiful. Thank you so much, Chris.
Thank you, Katie. Ditto on everything you said. We hear it a lot, and I'm going to say it again because we can never hear it enough. We can never have enough reminders that in this work, we have to take care of ourselves first. We have to maintain our resiliency. This is just the appetizer, as Katie said. We've got a lot of work ahead of us, and so we can't burn out too quickly. We need to stay connected to each other. As Katie said, we need to find our sources of truth, amplify those sources of truth, be the source of truth in this misinformation and disinformation world, and do that for each other, do it for ourselves, in order to maintain our fight in the long haul. So please, folks, take care of yourselves. I know this is a difficult conversation to have. It's very charged. So get outside. It's a beautiful day. No matter where you're at, take a walk, do something for yourself.
Yeah, learn a line dance.
Yes, get moving. Yes, people have to sustain this work, and I will emphasize for Robert is not here, but he brought it up. History. In the Proximity Project, we read the book American Sirens. We've had a previous one of these sessions with the author of I'm forgetting the name right now, but about the Black nurses, the name just escaped me right now, but read in these moments as well. Kind of the more I talked about fugitive pedagogy, Jarvis Gibbons, that book as well. You'll see that in his book, he talks about teachers were teaching one thing, and then when the person that was coming, the watchdog, superintendent, or whatever, they were like changing the book under the table and looking like they were teaching what they were supposed to be teaching, right? People have been doing this, right? Carter G. Woods and others, right? There's so many examples of this, and I think when we disconnect ourselves from history, then this is much harder, right? We feel woe is me. We feel like, oh, this is new. And to the point that was brought up by the panelists, we have to be able to start seeing what's coming, right? If this is the appetizer, and the playbook from before, not just in the US, right? Katie brought up Russia and other places then you can start to plan and prepare your people, prepare your organizations, because you're like, this is what's coming. So maybe we should preserve this or do this to make sure that we don't lose this vital information.